Good afternoon, folks. Daviess County Judge Executive Al Mattingly here with our weekly COVID update. And as you can see on the screen, we have a very familiar face who's with us again. Clay Horton with the Green River District Health Department is here, and he's going to talk about the public health aspect, the statistical aspect, and any and other of those kinds of things that might put you to sleep on a rainy day. Before we get started, let me talk about the cases and what's going on in Daviess County. And it was probably a light reporting period over the holiday, but for the last 3 days, we had 12 new cases reported in Daviess County. Up on the screen, it says that 38.68% of the Daviess Countyans, our population, have been vaccinated. We actually have about 50% of those who are eligible to be vaccinated, and by that I mean 18 years old and older have been vaccinated. Of those who are 65 years of age and older, we have 76%, just north of 76% of those. We're doing pretty good compared to the rest of the state, and we're going to do a comparison here in a little bit. We've had 186 deaths reported, so we had 1 new death reported in this past reporting period, and that we want to send our condolences to that particular family and to all those who have lost a loved one during COVID. You'll notice that we've had 10,642 confirmed cases. Our incident rate is 7.459. There's just one other thing I want you to take note on this slide. Find a vaccine near you, go to vaccines.gov. If you are considering getting vaccinated, if we can't convince you after this show, go to vaccine.gov. You can find a place that you can sign up for a vaccination. Many of those places now you can walk in and give them a call and talk to your healthcare professional about the vaccine and what can be expected. Let's go to the next slide, Jordan. This slide shows the current incident rate for all the counties in Kentucky. The overall current rate for Kentucky is 4.88%. Compare that to Daviess County at 5.3%. And the one thing that I want you to notice for the first time in, gosh, probably 10, 11, 12 months, there are no red counties. There are no critical counties there. Now, that doesn't mean that we're out of the woods yet, but it just means that we're doing a pretty fair job of tracking, treating, and vaccinating. If you look for the first time, we have 15 green counties. That's the most green counties I've seen, and that's those counties who have less than 1 per 100,000 of their population. You'll notice quite a few of them are smaller counties with very small populations. Easier for them to get there than it is for a large county like Daviess or Jefferson or Boone, Kenton, or Campbell. 16 of the counties are orange. That leaves 89 counties in the yellow. It's a wonderful testament to all the healthcare professionals and to you folks who are doing the things that you're supposed to do. Let's go to the next item, next one. If you look at, there you go. So right now, this is a comparison of Daviess County. Our percent of vaccinated population equal to or greater than 18 years of age is 49.98%. This comes from the Kentucky Department for Public Health. That compares to McLean County at 45.09, Lewis County 28.06. But look at Scott County, 65.06. They're really doing a great job. The state average, 57% of those 18 years of age and older have been vaccinated. So next slide. Whoops, that's the same. Well, no, this is those who are 65 years of age or older. So you're equal to or greater. Daviess County, 76.3. McLean County, 63.2. Lewis County, again, 39.5. But look at Scott County, 94.8. That's almost 100% of those folks. And the state average is 81%. 92% of the deaths occur as a result of COVID have occurred in those people who are 60 years of age or older. And I think one of the testimonies to the efficacy of the vaccine is the reduction in number of deaths that we have seen because of our senior population getting their vaccines. Next item. There we go. Again, if you want to find a provider, go to vaccine.gov and you'll see that there were 47 providers available in this area. All of them seem to have stock. They're within, surely you can find one very close to you, many times within walking distance, but if you cannot, then you can go to Audubon area to the Grits transportation and pull that up, Jordan. And all you have to do is give those folks a 24-hour notice. They'll come and pick you up and they will take you to your appointment. They'll wait for you and they'll bring you home. That's pretty cool. There is no excuse for, if you want a vaccine, there's no excuse for not getting one. The vaccines are free. So with that, one other notice before I get together with Clay. Well, a couple things. In a drive-through COVID-19 vaccine clinic, Greater Owensboro Chamber of Commerce is sponsoring it along with the health department, our Green River District Health Department, on Thursday, June the 3rd, 8:30 a.m. to 1 p.m. at the Owensboro Convention Center down West 2nd Street. Says no appointment required. Bring a photo ID and insurance card if you have it, but if you don't, come on down. Vaccines are free for everyone. Available to all individuals 18 years and older. I don't know what this means, free MRSH while supplies last. I have no clue what that means. They will have Johnson & Johnson, the single dose vaccine, or the Moderna, the two dose vaccine. This morning, I was involved in a conference with the governor, and he said a couple of things. One is the vaccines are working better than 90%. The vaccines are working. 97% of the cases of COVID that occurred in March and April, and this is according to the governor, so he must be right. 97% of those cases have occurred in people who have not been vaccinated. 97%. How about the other 3%? Some of them were breakthrough cases, but not very many. The majority of that 3% were people who had gotten their first shot and had contracted COVID. They got the first shot, felt pretty cocky, ran out to a bar, got a drink, adult beverage, and all of a sudden they came down with COVID. Think about that. It's proving even more effective than what we were told it was going to be. Vaccinations, since they were opened up to those 12 and older, and that's the Pfizer vaccine that they're using now, have started to trend back up a little bit. So the 10th to 19th in May, we did, May 4th, there were 47,000 vaccines. May 18th, there were 75,000 people were vaccinated. 30,000 of those were 12 to 18-year-olds. Most cases are occurring now in the 10 to 19 year range and the 20 to 30 year range. Again, 55% of women have been vaccinated. 55% of the vaccines have been administered to women and 45% to men. Come on, guys, get out there and roll up your sleeve. Don't let the women show you what wusses you are. So with that little finger shake at you, it's my pleasure to say hi to Clay Horton. Again, he's the director of the Green River District Health Department. And before I forget it, Clay, let me just say thank you to you and your staff for all that you've done during this, what is arguably the longest 15 months of my life. So, Clay, before I start questioning you, I'm gonna give you an opportunity to say a few things. What's going on?
Well, appreciate that, Judge, and always glad to come on to Facebook with you and talk about COVID-19 and bring the community up to date. You did mention our partnership with the Chamber with our drive-through clinic tomorrow, and just want to say thank you to the Chamber for helping organize that and asking if we would be a part of that. A lot of good partners in the community. You showed all the vaccine providers on the screen. Lots of providers in our community have stepped up to the plate and are doing their part to make sure that vaccines are easy to obtain for anyone who wants it. And especially with Owensboro Health, they've, I think Dr. Kelly has used this term a lot, that they've, tried to fill that role of being the workhorse for our community, and just have, given thousands upon thousands of doses of vaccine, and we're very appreciative to that. So we are excited about this latest phase, being able to offer vaccines to the age 12 and above. I don't think we're going to have Pfizer tomorrow at the convention center, but if you have a 12-year-old, there's lots of places in town to get Pfizer. Walgreens, CVS, Owensboro Health. We're doing a project with Owensboro Public Schools with their feeding site locations later this month and next month. So there should be lots of opportunities in our community for those who want to get vaccinated to find that opportunity and to take advantage of it.
I know Owensboro Health, the last couple of weeks have been at Friday after 5, providing. Now with us going back to winter this past Friday after 5, there probably wasn't a lot of folks to vaccinate down there, but they have certainly stepped up, as the regional hospital should step up in our community. Clay, we've talked about the significant decrease or decline in COVID-19. And I think the answer is obvious. Tell me why it's declining. What's going on?
Well, the short answer is our community is becoming vaccinated. And if you look at the trends, that's holding true across the country. Unfortunately, it's not holding true across the world. The world in general still has a very large COVID problem. And we're very fortunate here in the United States that we've had access to these vaccines as quickly as we have. And we've had a very successful rollout of vaccines, and that's showing up in the numbers. I can remember vividly having these conversations with some businesses back last April, and one of the things that I would say a lot is the numbers aren't going to lie when we were talking about how we approach this and how we address it. And I think the same thing's true now. The numbers are showing that vaccines are working, and unfortunately, we need to do a little bit more. We need to have more folks in our community get vaccinated. But even having said that, we should acknowledge what a success this has been, and the progress that we've made. It's really kind of remarkable.
It is really remarkable in the short time period from when we saw the first case and the development of the vaccine, the rollout of the vaccine, and the number of folks who have been, not just in our community who've been vaccinated, but throughout the United States. It's extremely remarkable. I know in the state, if we are somewhere north of 2 million folks vaccinated out of about 4.5 million people. So that in a very short period of time. Now, a lot of people are using that short period of time as an excuse not to get the vaccine. We don't want to be the guinea pigs. But I would say with the millions and millions and millions of people who've been vaccinated out there now, no one that gets the vaccine now is a guinea pig. I mean, we pretty much know, we know what the side effects are or can be, and we've not hidden those. I mean, the medical community has not hidden those side effects, but we also know what the benefits are, and we've got the numbers to prove what those benefits are.
Yeah, that's right. I mean, hundreds of millions of doses have been administered at this point, and we are seeing the success from that. And that's not to say, CDC and the medical community take side effects very seriously. There is still a great effort into looking for adverse reactions, but I think we can say wholeheartedly at these points that these vaccines are safe and they save people's lives. So, I mean, there's just a tremendous upside for us to continue this effort, to continue to provide those opportunities and allow people that have been a little bit more hesitant, or the people that wanted to kind of have a wait and see approach. Now's the time. The opportunity's there. It's never been easier.
And I think, again, my advice, and I've been doing that since we've been on here, if you're hesitant, talk to your doctor. If I have some issues with other medical procedures, or if I'm going to have a joint replacement, or if I'm going to be on a new drug, I talk to the doctor and ask and talk to them about those kinds of things. And hopefully you have a trusting relationship with that doctor, because the main point for him providing you with that service is to make sure of your well-being. So to me, again, of course, I come from a science background. And I come from that era when measles, mumps, chicken pox, polio, and all those other diseases were still out there, and we didn't have vaccines against them. The vaccine was if one kid in our family of 12 kids got chickenpox, they all got chickenpox. That was the vaccine.
Yeah.
So,
and we've heard some of that too with COVID. You know, we've heard the
right.
argument that I was infected already, or I'll just take my chances. The vaccine is a much safer alternative to developing that immunity than actually there's less risk involved with getting vaccinated than contracting COVID and all the bad things that can occur from there.
And Clay, let's be realistic about side effects. Now, certainly, if I have the side effect, that's one person, very important to me. But if you look at a population, one person, a population of 1 million, statistically, it's insignificant. It doesn't mean a lot. And the downside of not vaccinating that 1 million people means thousands of deaths and thousands of hospitalizations, and we don't know really yet the long-term effect of COVID on those who other. We're going to miss you, but you're cutting back on the number of reports that you do. And I know people are going to miss me when, next week, as I said, will be our last COVID update. Tell me what we can expect from the health department in terms of reporting things now.
Yeah, so we're still obviously tracking COVID very closely. We did press release 7 days a week for a long time. We've been doing them about 6 days a week for even a longer time now. We've made the decision that we're going to, if things continue on the trajectory that they are, and it looks like they're going to, we're going to a twice a week schedule for our press release. Now, there is still access to this data on a 6 day a week basis through the kycovid19.ky.gov. That is the state's website. They have a very good data portal there where you can track the 7 day incident rate. You can also look at the positivity rate. They even have county level positivity rate now. But what I would suggest to people that want to keep tabs on this from a day-to-day basis, like we do here at the health department, is to look at the state's website and look at that 7 day incident rate. That is going to be probably a better metric, a better way to monitor what's actually happening in the community than looking at a day-to-day report where you can have, you can have lags over the weekend and you can have big spike ups certain days of the week as providers catch up. But yeah, Jordan's showing that there now. Yeah. He rolls back up to that desktop dashboard. There's just a wealth of information there that'll let you even kind of select your views, let you look at the positivity rate, look at all the demographic information. So this is the same data stream that we are operating out of. We use a system called the National Electronic Disease Surveillance System, or NEDS. And that's where this information, this is what's feeding this dashboard for the state. So you'll see maybe some variations in reporting periods. But over the course of the last 15 months, there's very little lag now. Maybe 12 hours would be the only lag between the state's calculations and our calculations. And that's really a result of when does our epidemiologist pull the data and when does their epidemiologist pull the data. They're essentially the same. We've been watching it on a daily basis for not quite 15 months because this hasn't been available, but ever since it's been available, and we've never seen a material difference between their data and our data.
I started looking at it end of last year because it delves into a lot of things that nerdy people would like to look at, and I can't believe that there's not a statistic or there's not something that somebody would want to know that they can't find out. One of the ones that I continually watch, because I'm always comparing Daviess County to my sister counties, is there. If you look on the right hand side, they'll show the county statistics showing the current rate, the positivity rate, the number of cases, the number of deaths. And it just kind of gives you an idea where is Daviess County in relation to the sister counties. The up in the top, if you'll go back, Jordan, just a little bit, just go back one page. Yeah, there you go. If you look at the desktop dashboard, You also look at daily reports down there in the lower right-hand corner, Kentucky COVID-19 daily reports, and then they have reports for different classes of folks. There you are. Now scroll all the way down through there. They show you age distribution by race. Keep going. Stop. There's current regional statistics. We're in region 2. It'll show you the number of cases that we have there. Go on one more. Can you roll it? Yep, there you go. This is total cases by county. This is each county, and if you look, Daviess County, I think, is about number 6, if I'm not mistaken, in total cases. And one more. Go up one more, or down one more, whatever you. No, the other way. There you go. All right, stop. Now, go down to new cases by county. There you are. New cases by county. If you look at that, you can see that Jefferson County reported 32 cases, Fayette 12, Lincoln 5, Bullitt 4, Knox 4. If you go on down through there, you'll find Warren, and somewhere you'll find Daviess. But that tells you the number of new cases by county. And they'll do it daily, and I think they update the map daily as well, don't they? Now, they didn't over the holiday weekend. Sometimes there is a lag or delay, but everything that you'd ever want to know, you can find there, and we will look forward to Clay verifying it twice a week or so.
Yeah, Tuesday
Yeah.
and Fridays are our planned schedule.
Okay.
Friday, just kind of going into the weekend to make sure everybody's aware of what's going on, and then Tuesday we're attempting to maybe kind of look at the past week and see what the general trend is.
So lots of talk. I've heard some of the folks out there, hey, here's the topic. Have you had your vaccination? No. And I'm not going to get one. I'm going, why? And they said, well, I had COVID. I don't need to get the vaccine. I don't need to get vaccinated. How do you respond to that person?
Well, there's a lot of data that suggests that the immune response from the vaccine is more robust than natural immunity. I mean, there's still a lot to be learned about natural immunity and how long it lasts. But the current recommendation from CDC is even if you were infected with COVID-19, that you're encouraged to get vaccinated, that you will have a greater level of, you likely would have a greater level of protection by receiving that vaccine. Now there are some cautions to that. If you were received the monoclonal antibody treatment or you had the convalescent plasma treatment when you were sick, the recommendation is to wait 90 days before you get that vaccine. If you're not sure if you had those type of treatments, talk to your doctor. Find out, that both of those would be an infusion. So if you didn't go to the hospital or and get hooked up, you didn't have it. But that would be the only exception. So we would still encourage you to get vaccinated. And like we said earlier, there's lots of opportunities. Depending if you want to do the one-shot Johnson & Johnson, it's available in the community. And then the Moderna and the Pfizer are also widely available.
Now, as I've said before, my wife and I had the Moderna, and other than a little irritation at the injection site, you get that with flu or penicillin shot. I had a little bit of ache or tiredness the day after I had my second shot. 12 hours I woke up and I felt fine. I mean, and my wife had no reaction. She said my arm aches, and that was it. So the folks that have had COVID. What I'm hearing you say is that going ahead and getting the vaccine is like a booster to their natural immunity, and they will have even greater protection than they would have if they didn't take it at all.
Yeah, that's a good way to. That's correct.
Yeah. Now, I still hear some people taking hydroxychloroquine.
Yeah, so I think that would not be recommended to this point. I think that the data is pretty clear that it doesn't have a beneficial effect, and it may even have additional risk to it. So I think as we talked about earlier, the numbers don't lie, and the success we're seeing with vaccines. CDC last week put out a scientific brief. It was kind of a collection of studies that are available to this point. It's available on their website. And, they have a nice table that shows a variety of studies that were conducted and what the effectiveness on the vaccines were. They look at Johnson & Johnson, they look at the mRNA vaccines, the Moderna and the Pfizer, and they all kind of evaluated things a little differently. Some looked for symptomatic infection, some looked for asymptomatic infection, some looked for just whether you went into the hospital. But the remarkable numbers all around, and especially at preventing people from being hospitalized or causing death.
So here we are. If you recall, last year, everybody talked in the spring. We said, well, wait till the hot weather gets here and it's going to go away. And it didn't go away. And then we got back into the winter months and it surged. Now we're coming into hot weather again, and it seems like it's going away. Now, there are going to be people who say it's not because of the vaccine, it's because, but I keep reading some statistical or some scientists who are saying that when we go back to school this year, that's possibility would be we would see another surge brought on by school kids. That school kids kind of have a natural immunity. When I'm talking about school kids, I'm talking about young kids in school, kind of have a natural immunity. Every virus to them is almost a novel virus because they've never seen it. So their body kind of has a natural way of dealing with that. But we all know that children who are in daycare or in school bring all kinds of diseases home to mom and dad and the rest of the kids. So what do you think? What are you hearing about things like that?
Well, I mean, it's obviously something we're going to keep a close eye on. We're hopeful that it won't be too much longer before we have vaccines approved for that age group under 12 years old. I've heard in the fall. I've also heard maybe more likely the beginning of 2022. But I think that'll just depend on how those clinical trials progress. And we're very hopeful. I've got a son that turns 11 on Saturday. So he's a little over a year from being eligible. We would like to have that opportunity for him to be vaccinated before we go back to school, just to keep the rest of the family safe.
Well, one of the things that you heard last year about schools being closed, and I'm not going to get into the political side of it. One of the problems and one of the reasons schools had to close was we were having support personnel and teachers who were coming down with COVID. So when half your teaching staff or a third of your support personnel had COVID, you had to close because there was no one there to teach, no one there to operate the plant. If we can get them fully vaccinated where they're not dropping, if you have a few children who are coming down with COVID and have to stay home, it's not as bad. If you're following what I'm saying, it's kind of, you can maintain and keep the school open then. And that's why it's important for all of our teacher personnel, all those people who are involved in what I would call institutions, such as nursing homes and jails and prisons and schools. It's important for them to be vaccinated, very important. So, have you heard of any, and I'm throwing some things at Clay that we haven't talked about, but have you heard of any what's the viral treatment, Respivir or something like that, Valtrex, something that is out there that seems to have some effectiveness on viruses? We all know this is a virus, it's not a bacteria. So, antibiotics don't have an effect other than on any secondary infections that might be caused by COVID. Have you heard of any of those treatments in development that are out there and available?
Yes, and you're right. We hadn't talked about it, so I may stumble on the companies, but there are some promising antivirals and some other therapeutics that are, I think, near being authorized. So yeah, there's hope on that front as well.
Well, and that's important. If you have a breakthrough case, and we're going to talk about them, now you have a second line of defense. You have a protocol that is going to be very helpful in treating that disease. I mean, the hospitals, think about it, the hospitals went from having nothing. They absolutely had nothing. Treat the symptom, make you comfortable, intubate you if it got to be that point, but they had nothing. And they developed some, and I think, again, that's one of the reasons why we have fewer long-term hospitalizations because they've learned how to treat folks with this. So when I said breakthrough, that brought one to mind. There's always a question as to, well, if there are breakthrough cases, meaning I got vaccinated and I ended up with the disease anyway, why in the world should I take the trouble to be vaccinated?
Well, I mean, I think you're playing the odds, and breakthrough cases are relatively rare. I mean, no vaccine is 100%. So we expect some level of breakthrough cases. We expect that to be normal. There is a process in place where the CDC is studying those. We play a role in that here locally, in that, we do the investigation and report the data into they call it a red cap system that goes through the state health department and the CDC. The last I read, I think the CDC is primarily concentrating on those breakthrough cases that have severe outcome, those that result in hospitalization or death. But yeah, we've had close to 11,000 cases here in Daviess County, and I think we've investigated around 35 breakthrough cases. So it's a very, very small percentage.
I can tell you back, I believe it was the end of April, 1st of May, I asked you that question. At that time, we had 28,000 folks vaccinated and 20 breakthrough cases. That means out of the 28,000 fully vaccinated people, 20 developed COVID, as indicated by the test. Symptoms for the most of them were very mild. I think you told me that 2 of them ended up in the hospital, and 1 of them was there because of a broken ankle, not because of COVID.
Yeah, there was some kind of injury, and then they tested positive at the hospital.
Yeah, so that's pretty good. I mean, I'm willing to do that if I, and again, if you do the division, that's about 0.7% breakthrough cases. Now, if you look at the number of cases in Daviess County, and you said roughly rounded up to 11,000 cases, we have 100,000 people, you had a chance of 1 in 10 of developing COVID. 1 in 10, so 10% versus 0.7%. I'll tell you which one I'm going to choose every time. So I think we've already talked about that, vaccines being available to kids under. So, there were parents who had no problem vaccinating their kids for measles, mumps, and chicken pox and whooping cough and all those others because it was required to send your kid to school. But now we're having some parents who perhaps don't want their child to get vaccinated, and even those parents are vaccine hesitant. What do you, to me, we were no more sure of the long-term consequence of those vaccines than we are of the COVID vaccine.
I think it's a natural question to pop into your mind and something to wonder about. But I think earlier in the conversation, your suggestion, your advice was for those that were contemplating it to talk to their medical provider. So I would say for those that have questions, talk to their child's pediatrician. Take their word for it. But the clinical studies for that 12 and above age group had exceptionally good outcomes. Even fewer side effects or risk associated with the adult population. And I can't remember if it was the Moderna or the Pfizer, but one of them had a 100% efficacy rate.
Right.
So the children, the younger kids, their immune system is stronger, and they have a stronger immune response to these vaccines.
Well, and what I'm going to say is tongue in cheek. The reason parents didn't question back then as much as they do now is Facebook didn't exist and all the conspiracy theories weren't floating around. So that probably has a lot to do with it.
I would agree with that. Listen to your pediatrician, not your half crazy uncle on Facebook.
Right. So here we're toward the end, and the governor's mandates for the most part end on June the 11th. I know the face mandate, I was a little disappointed, not that I want to wear a mask, but it was a little confusing. So I don't want to ask you, have you had both shots? But at the same time, I'm going to trust that you had both shots. And there are people I know who didn't have the shots and they're still not wearing masks. But so the mask mandate ends, but that there are also some provisions. It doesn't end for hospitals. It doesn't end for nursing homes. It doesn't end for jails and prisons and places like that. But for the most part, it ends for all folks. Advice to people who have not been vaccinated, and as of June 11th, we'll be able to go around no face mask at all and no social distancing at all. Advice for those folks, advice for all of us, not just those folks, but for all of us.
Well, I think, we're moving to a phase where the public health community is going to be more in a role of providing guidance and recommendations. And I think that we're able to do that because we've made so much progress and because so much of our, of our community is now protected. And ultimately, we're kind of in this transition where we're going to, COVID-19 is a vaccine preventable illness. So, we'll probably try to manage it more like we do other vaccine preventable illnesses. And that wasn't an advantage that we had this time last year. So I mean, I would say that, continue to follow the latest up-to-date public health guidance as provided by the CDC. The mask mandate in Kentucky has already been revised to reflect that guidance, that if you're fully vaccinated, that a mask is not necessary for most people. And I say most people because we do have people in our community that are immunocompromised, that even if they've been vaccinated, it's unclear about how much protection that vaccine affords them. So for those individuals, we would still recommend that they wear a mask in public. We would recommend that they continue to social distance and be careful about their close interactions with people outside their household. And we'd ask the rest of the community to be understanding of that. This wearing a mask is not a political statement. It's something that someone's doing to reduce their risk. As far as hospitals and nursing homes and jails, I'm sure there will be federal transportation, the public transportation, interstate transportation is still going to have a mask requirement. I'd say just follow that guidance. We'll still have a voice here at the health department in recommending what people to do, but we're moving past the phase where it's an enforceable action. There are the tools in the community for people to protect themselves. And it's not to say that we want to discourage people from protecting themselves, but we're just coming to a different phase. I think we're going to be more of a recommendation or telling you best practices here on out, and out of the enforcement business, thankfully.
Last question before we end. Do you think that we'll need a booster?
It's unclear. I think I read last night that NIH is doing some clinical trials on boosters. We'll have to wait and see. I think it stands to reason that our immunity wouldn't be everlasting from a vaccine, but what that interval is, we'll just have to wait and see. So I feel a lot better each time data is released on these vaccines, because it is showing evidence of up to this point that we're seeing long-term immunity, but it wouldn't be unrealistic to think that may wane at some point and a booster would be needed.
Well, if you think about it, of course they adjust the flu vaccine every year trying to guess which strain will be most prevalent, but regardless, you're getting a booster every year, and it would seem to me that is going to be the case. Although I find it interesting that you don't get a booster in smallpox, you don't get a booster in some of the other shots, but regardless, I think a booster will end up being a one shot and not a two-shot ordeal. It'll just be something to kind of give your immune system a kick and go from there.
Sure. There's other examples. Tetanus, they talk about a booster every 10 years. So,
yeah.
That's something that's, a long-term type thing. So, right. But again, if we get enough people in our society vaccinated now, the rates will come down low enough that it reduces everybody's risk anyway.
Well, in effect, the virus burns itself out. It has no fuel to fire it any further in the community. Clay, once again, I want to thank you for all your hard work in our community. I want to thank you for always being gracious enough to appear anytime that we've called. And let's hope that this community continues to fight, that we gear up, we don't lose anybody else to COVID, and we have a normal summer.
I'm looking forward to it. And thank you, Judge, for the opportunity to talk again, and happy to come back anytime we need to.
Thank you, Clay.